Good evening, everyone. My name is Chris Cowan, and this is HCH 322 Healthcare Ethics and Medical Law. This video is being made for Week 2, Discussion 2, Courtroom Drama, dealing with Case Number 4, where I will be rendering a decision in favor of either the plaintiff, Kara O'Leary, or the defendant, A.U. Bright Smiles Dental. The issue being dealt with today is whether the plaintiff, Kara O'Leary's personal health information was exposed and left unprotected by the defendant, A.U. Bright Smiles Dental. I will carefully review arguments from both sides, the plaintiff and the defendant, and then make my ruling. The plaintiff, Kara O'Leary, is suing A.U. Bright Smiles Dental in the amount of $50,000 per violation of HIPAA rules and regulations for the exposure of her personal health information which was left unprotected. The defendant, A.U. Bright Smiles Dental, is defending their facility by stating that they did nothing wrong with the plaintiff's personal health information. First, the plaintiff, Kara O'Leary, she is claiming the defendant, A.U. Bright Smiles Dental, should be held for their blatant exposure of their patient's personal health information by placing red stickers on the outside of the folder with the word AIDS written in bold print and left out in plain view for the families, patients, and other staff to see. This is a HIPAA violation. According to the United States Department of Health and Human Services, HIPAA, which stands for Health Insurance Portability and Accountability Act, requires appropriate safeguards to protect the privacy of personal health information. It also sets limits and conditions on the uses and disclosures that may be made of such information without the patient's authorization. By flagging the personal information of the plaintiff with a red sticker and the word AIDS written in view, as you can see, this was a violation of HIPAA. The defendant, A.U. Bright Smiles Dental, is fighting against the claims brought upon their facility. They state they did nothing wrong. The red stickers are flagged on the files to alert the staff of certain things such as wearing PPE, which is personal protective equipment. It also alerts the physicians to carefully consider these particular patients when prescribing medications. A.U. Bright Smiles Dental states that flagging the files only is done for the safety of the patients and the staff. After carefully reviewing both sides, I rule in favor of the plaintiff, Kara O'Leary. I feel the acknowledgement of the patient exposed to AIDS should be handled in a different way, as stated by Kara O'Leary. When files are left unattended, the exposure of patients' personal information can be linked to the public. This can lead to embarrassment for the patient. This can also lead to the patient being treated unfairly. The red sticker should be placed inside the patient's folder and locked away until the physician is ready to view the patient's file and examine the patient. Personal protective equipment should be worn with all patients, not just patients who have been exposed to HIV and AIDS. This is very important in the healthcare field. As stated earlier, I rule in favor of the plaintiff, Kara O'Leary, in the amount of $150,000. $50,000 for the exposure of patient personal information, $50,000 for leaving the file unattended, and $50,000 for the pain and suffering that Miss O'Leary has endured. HIPAA is very important in today's world, in today's health field, and it should be carefully examined by all personnel. PPE should be worn with all patients. As I've stated earlier, it is very important to protect the patient and to protect yourself. So again, I rule in the favor of Miss O'Leary in the amount of $150,000.